We actually have had a lot of questions come through, and you have some as well that you were prepared for. So let me pull up some of the ones that came through. This is for Dr. Udoff. Do you have a hard stop for recipients' ages?
Yeah, that's a tricky question. One that there's a lot of discussion in our field about how old is too old for donor egg. Physiologically speaking, we think it'll probably keep working as long as you keep trying, but there are a lot of ethical considerations about that. And so we have a leadership group here in our practice, and we meet every year and review what we think makes sense. We also look at our medical society, American Society for Reproductive Medicine, has some ethical guidelines on this. And for our program, we will selectively treat patients up to age 55, but there is a hard stop at age 55.
There's a question about how the matching works for this process with frozen donor. Do the donors have to choose and accept us as well?
So I can answer the part about the donor. So the donors do choose us to come work with us, and they are counseled and consented on the different avenues that their eggs can be used. I mean, they're all intended initially to be used to match with the recipient. The donors all relinquish the rights to their eggs when they consent to cycle with us. There are times that eggs will go to research if they're not of good quality or something of that nature, and the donors are aware of that as well. But yes, they do select us. They choose to work with us, and they're able to do 6 lifetime cycles over whoever they choose to work with, and many of them come to work with us and will complete all their 6 lifetime maximum cycles with us.
And if I could just jump in from an aspect of the recipient aspect, no, the donor does not have to select the recipient. So the recipient is fully in control of selecting the donor of their choice. So it is not a two-way street at that point.
Given all the screening that we do, is there a recommendation that PGD testing is done on any embryos that are created?
I guess I'll take that one. Thanks. This is an interesting one, and so PGT, or as it's now called PGTA, pre-implantation genetic testing for aneuploidy. So this is evaluating embryos that are created, in this case from donor egg, to see if they carry a normal number of chromosomes, because we've learned that one of the main reasons why an embryo doesn't implant or maybe a miscarriage occurs is because just randomly, this is what nature does, the embryo may carry an extra missing chromosome, and then that isn't going to work out to be a healthy delivery. And so there is this technology available where you can do this test to determine whether the embryo is normal for chromosome numbers before it's even transferred. But in the setting of donor egg, there's a lot of controversy. There's a lot of controversy about it, period, because the medical literature has struggled to try to show that it truly improves success rates. And this has been one of my areas of interest and research focus for as long as I've been in this field. So I've followed it for some 25 plus years. And it sometimes science has trouble providing the answer of a simple question, is this good or is this bad? Because these are difficult studies to do, and then there's so many confounding variables. So we are here in our clinic a PGD center. We were one of the original clinics to perform the technique, and it is our area of specialty. But even with all of that, I have a very frank discussion with my patients about I'm not 100% sure that this is the best thing to do, particularly with donor egg. And the reason is it has to do with the probability of the embryo being normal. So when someone is older, the probability of the embryo being abnormal is much higher. And so it's much more important to get that information, is the embryo normal or not. But when you're using an egg donor, the probability of that embryo to be abnormal is much, much lower. And so even without that information, chances are you're probably okay. And getting that information is a bit involved, and there's no perfect test. So there's not a simple answer, yes or no. I can tell you in our practice here, that it's less than half the time that people use the PGT-A technology for donor egg, and the use is much higher when patients are using their own eggs, particularly older patients. But it is something that we talk about, and it's interesting that it came up in the questions, because it is just one of these simple questions we don't have a simple answer for.
Questions came up regarding the number of eggs that are guaranteed in a cohort, the number of cohorts that are available per donor. So I'm going to break these into a couple of different questions. One of the questions regarding the number of cohorts is, if a donor has one cohort available, do we reach out to her to cycle again? And within that question, how many times can a donor cycle?
Okay, so I can go ahead and get started on some of those, Debbie, and then you can jump in on that tail end question, because that was definitely your team. So a single cohort has a minimum of 6 eggs. In some instances, based off of how the cycle panned out, we do have some donors that may have cohorts that have 7 or 8 eggs available. But at a minimum, you will have 6 eggs per cohort. The second part of the question was related to
if there's only one
reach out to them.
Available. Yeah.
Oh, right. So I'm gonna punt that to Debbie.
So each time a donor goes through a cycle, we have a review board that every time the donor cycles, her eggs come into our office. We sit down as a group every week and we review the donor cycle. We review the cycle, we review the history, we review the outcomes to make sure that this is a donor that we want to have in our program and we want to continue to have in our program. So if a donor, with the results and the information we have when those eggs come into our office, will determine if we want the donor to cycle again. We will continue to cycle the donor as long as she does well and she's she's popular and she is presenting us with the good product. There are times that we put a donor on hold, and then once our inventory gets lower, yes, we'll reach out to the donor again and have her cycle with us again. Again, she has a lifetime maximum of 6 cycles that she can perform, and if she's cycled anywhere else before, we do count those as part of her lifetime maximum. Hopefully that answers your question.
And there was one other piece of that. So Teri, if there's one cohort available for a donor and a recipient is looking for a donor with multiple cohorts, how can they look for donors that have multiple cohorts?
The best way to find a donor that has multiple cohorts really is to work with your client relations specialist. So the important thing is to provide a list of maybe 3 to 5 donors that you're most interested in. And then when you connect with the client relations specialist, they'll be able to tell you how many cohorts of that donor is available. To piggyback on that, if the donor has just one cohort available, while we will not specifically request a donor to cycle again to produce an additional cohort, you can favorite that donor on the website, and when she becomes available, you could then purchase an additional cohort from her.
Can you talk about dominant versus recessive traits as it pertains to donor eggs? Is there easy reading material that can be referenced? Do you want to go into that or refer to the genetics?
Well, that's a simple one. There would not be an egg donor that carries a dominant genetic trait, because that would mean they themselves are affected by a genetic disease. So that would be an exclusion.
Okay, perfect.
And we also did a previous webinar about genetics, and so that's available, I believe, to view on our website. So
yes. I believe you have a couple of questions as well.
Absolutely. Because of COVID-19, I am not quite comfortable going to the doctor's office. How long can the egg stay frozen? Months, years? That's a great question. So with vitrification, I can, with some confidence, say indefinitely. Dr. Udoff, what is the longest you've seen someone use frozen tissue? I think in my years of practice, 22 years later, they came back to use a frozen embryo.
Right. Yes, we've had cases here that have been 20-something years, My answer to that, tongue in cheek, is usually till the building crumbles. So it truly, as you know, Amanjot, that we use the term frozen, but this is not freezing in this sense of the real meaning of that term from the technical standpoint. Vitrification is vitrification. The term glass-like state is often the descriptor. And so literally, I don't know, 100 years, longer. So it practically speaking, it's for as long as anyone would ever care to want it to survive.
Comparing fresh eggs versus frozen for successful IVF is a question that's come up several times, and I think you addressed that earlier in the presentation, but could you cycle back to that again?
Do you want to show the slide again, or do you want to expand on that point?
Cover it again on top. But,
yeah. So as Amanjot and I were talking about the things we covered during the donor consult, of course, the discussion about success rates is an important one. And in our program, we offer fresh cycles as well as egg bank cycles. And 90+% of our patients choose the egg bank because of the advantages that come with an egg bank. But part of that discussion is also the success rate. And so anytime you're talking about success rates in the world of IVF, you have to be very specific about what is your outcome that you're talking about. And one mistake that's commonly made is that you're comparing the traditional fresh IVF donor cycle with an egg bank cycle. And that is not apples to apples, not even close, because a typical fresh cycle would yield around 18 eggs or so. And as we were talking about, a cohort of eggs is typically 6 or 7 or 8. So how can we get the same pregnancy rate from 6 that we get from 18? Doesn't work that way. And it never intended to work that way. The idea was that over decades of doing donor egg IVF and fresh cycles, what we found is that for many of our patients, there were more eggs than they ever needed. We know we still have these embryos here. I have patients that are in their 60s, if not 70, and their embryos are still here. They don't know what to do with them. And we were happy and celebrating when their donor got 25 eggs and that they've had 4 babies and now they got 8 embryos left. It's almost become, oddly enough, a burden that they don't know what to do with them, and here they are. And so part of the idea of the egg bank was what's the most efficient way we can do this? What is the minimum number of eggs that we could use and still give someone a very good chance for pregnancy? And that's what it's really about. It's not meant to be as successful as an 18 egg cycle. It can't. It's not 18 eggs. I mean, it could be if you buy 3 cohorts of 6, it's 18, right? But it's not meant to be that way. It's meant to give you that option of saying, how many eggs do I need to have a baby? Maybe I don't need 18, maybe 6 will work. And if it does, you're done. And it's great. And we've gotten so good at this with the technology, even our 6 egg cohorts, some 65+% of the time give us more than one good embryo. So you have to really phrase the question carefully. And so to try to give you a real answer here, I believe in the studies that were done even before we started the commercial endeavor of an egg bank, in which they would have a donor go through a stimulation, same donor, same stimulation. They would divide up the eggs. Some they would vitrify, some they would use fresh, and they found the success rates were the same. And to me, that shows that done ideally, they're the same. I mean, of course, the exception would be the egg that doesn't survive the freezing and warming, but about 95% of them do. And once they do, they seem to fertilize just the same, develop the blastocysts just the same, and make babies just the same. So they're in our field, anything new undergoes a learning curve. Things we do routinely now, we don't blink an eye, all went through this. I know when ICSI started, so ICSI is the acronym for intracytoplasmic sperm injection, injecting the sperm into the egg to get fertilization. Most common way we fertilize eggs now. And I lived through the era when people couldn't get this to work. They thought this was like the worst idea in the world. We're not getting any eggs fertilized. But it's routine now. And so what we've observed, very interesting from our point of view, working with all these clinics, we've seen over time how everybody is getting better at this. And we have a whole team of traveling embryologists, Amanjot being one of them, who gets to go all over the country to bring everyone up to the highest level, so that we can see that egg per egg, it's essentially the same. So to really answer that person's question, they need to talk to their doctor in the center they're at. I think that's really the direct question and answer. But from our point of view, we think that it's just a matter of time before the national data starts to show their equivalent, because we have many centers where it really is essentially the same, and it starts to mimic that controlled research study experience that we saw years ago, that in the right hands, it should be essentially the same, egg per egg.
I have two questions I'm going to ask simultaneously, so Amanjot can get back to one of the slides and Teri can answer this question. Amanjot, can you go back to the statistics slide? And Teri, how easy is it to affiliate a clinic that's not currently affiliated with us?
Great question. So it's relatively easy. A lot of the clinics that we have been able to affiliate with have come on the recommendation of a intended parent like yourself that's interested in purchasing frozen donor eggs. So when we get that notification that a recipient is interested in purchasing frozen donor egg and we're not affiliated with the clinic, then I will reach out to the clinic, or our business development manager will reach out, and we will notify the clinic that they have someone that's interested in purchasing frozen donor egg. Our affiliation process is really 3 steps. It's a signing of an agreement, it's the completion of an onboarding webinar, and then a lab collaboration visit, just to ensure that they are familiar with our protocols in the lab. So it's really not that hard. I mean, I could probably count on one hand clinics that have made a decision to not affiliate with us for one reason or another. And if that does happen, then we're happy to provide you with a list of affiliated clinics in your area. Of course, we recognize that you've probably established a relationship with your clinic and have had years of time with your physician. So switching clinics may not be the most ideal. However, if the donor really is the donor that you feel a connection to, then it might be something to consider.
There have been lots of questions about the statistics. They wanted to see this slide again. Primarily on live birth rate was the main question, and understanding the egg survival rate. So those two were important to folks who were asking. So can you talk a little bit
I'm happy
about,
to take this if you like.
Yes.
Sure. The only thing I would add as we look at these statistics, in that we are basing these numbers off of the reporting we can get from the clinics that use the eggs. And the reporting back to us is incomplete. And so when most people are talking about statistics, they are often referring to the published statistics, the government-based statistics that we call the SART statistics, Society of Assisted Reproductive Technology. They have a much more sophisticated mechanism of data collection than we do, and they have a law that we don't have that says the clinics have to report to them. Clinics don't have to report to us. You know, they usually do, but they don't all report. And as the saying goes, bad news travels fast. And so because of course it makes sense, with the guarantee, if something goes poorly, they're going to tell us they want another cohort. But if something goes really well, we may be forgotten. And so we I think have good reason to believe that all of our numbers are going to be skewed downward a little bit because we just have incomplete data reporting. And it would be fair to assume that in that group that has not reported back to us, they're probably mainly positive outcomes. Otherwise, they would be complaining or rightfully so, requesting another cohort of eggs as a replacement.
Yeah, I appreciate you mentioning that skew. That is incredibly important. And I just want to point out again that this data is across our 300 clinics. It's not cherry-picked. So the egg survival rate after thaw, like Dr. Udoff mentioned, with the vitrification process, it is delicate. What we're finding is that with more experience, success rates improve year over year as more and more laboratories are becoming familiar with not just vitrification, of course, but the vitrification of oocytes and how to warm those oocytes. And talking about some of the pregnancy rate, clinical pregnancy rate, and live birth rate, what is the difference there? So pregnancy rate is a blood test was done and a BHCG was found to be positive. So at a blood level, you were indicated to be pregnant. Clinical pregnancy rate refers to when an ultrasound is done and a gestational sac is visualized and a heartbeat is visualized. And a live birth rate, like Dr. Udoff said, I also put a little asterisk next to it. As you can imagine, once you have a newborn, people are incredibly busy and sleepless. And so data, that's really the precipice of where data tends to fall off. So that number, like Dr. Udoff mentioned, can only be higher across the board. Good news travels much slower than bad news. Though actually our client relations team gets super cute pictures of some of the babies, and we love seeing those. It makes us incredibly happy.
One more question. I think we're running pretty close to the hour spot here. Teri, can you talk about the discounts that are available? I know we have a military discount and we have a multi-cohort discount and a 3-cohort as well package.
Absolutely, happy to share that. So our discounts that are available really are dependent on your clinic's affiliation status with us. We do have some clinics where you would remit the payment directly to them. And through those agreements, we don't have any additional discounts that are available. But the majority of our clinics, you will remit the payment to Fairfax EggBank. And in those instances, we have a few discounts that are available. The first is what we call our multi-cohort discount. So if you purchase more than one cohort, either in the same transaction or you return for a later purchase, you are eligible for a one-time $2,000 discount off that second cohort. If you are a military family, active or retired, just to show our appreciation for your service, we do waive our standard shipping fee at all times. On occasion, we'll waive or reduce shipping fees for various groups of people. And then we do have a 3-cohort package. And that 3-cohort package allows you to purchase 3 cohorts at one time at a significant savings.
That's great. Thank you. We do have, I think, a lot of additional questions on here that are going to end up having to be answered in a blog because there's a lot of detail. And certainly many of the questions that people have asked today are very specific to their personal situation and would be better answered by a client relations specialist one-on-one.
Sure.
So we haven't ignored you. We're looking at all the questions now, and we will definitely make sure you get answers to anything that's been asked today one way or another.
Absolutely. And if I could add, if you have a very specific question that might be best suited for the client relations team, if you could please provide the clinic that you work with, that's extremely helpful.
Amanjot?
So again, thank you so much for taking time to join us today. Larry, Debbie, Teri, I appreciate your time. And again, please reach out to Fairfax EggBank if we can help you on your donor egg journey. We appreciate it.